Good morning, everyone, and thank you for being here. This has been one of the most exciting days of my career in being a school administrator. Governor Shapiro had a wonderful talk with our students, and I learned a few things today that I need to be doing better and the school district needs to be doing better. So students, I'm really thankful for your input. It is amazing when we sit around and talk about one of the major issues in our society, mental health. Mental health is an issue that we as school administrators deal with every day, whether it's with our students, with our faculty, with our families that we're working with. It is something that drives all of us to the point where what more can we do is we're asking ourselves all the time. And when I started here 11 years ago, we had 1.5 guidance counselors. Now we have 3. Additionally to those 3 guidance counselors, we have 8 different counseling services, or services doing outpatient and all kinds of different things that are going on. But the common thing we keep hearing is it's not enough. And what was really kind of eye-opening for me is when we're talking to our students, many of them say they don't feel comfortable still coming forth and getting help. So we're bursting at the seams with just trying to meet the needs of the kids that are actively acting up or having severe crises, and we're missing, it looks like, some other kids that are struggling silently. So I think that was my biggest takeaway from this morning, and hopefully we can do better and move forward. Governor Shapiro's budget would make a big impact on us. We are a big winner in his current budget proposal that was passed by the House. If that budget passes as is, we are going to hire 2 more guidance counselors to kind of help with some of the issues that the kids pointed out. We need to get better with transition services, but our normal counselors are dealing with trauma and drama all day, so it's hard to help with the career planning aspects of things. It's hard to do group counseling and help a larger group of kids when you're over here handling a problem or over there or dealing with bullying or what have you. So I'd like to applaud the governor for his efforts and his proposals. I will tell you the biggest fear I have as a superintendent is we have all of our services here, and at one point or another, we can't help these kids. And so when we refer them out into the county system doesn't have the resources or the staffing to make that happen. So that is another bonus in the governor's budget proposal. He is proposing more money to the county to help build up those resources at that level. But we do need to come up with a plan, because as a superintendent, I know a kid's in crisis and they're told to come back in 8 to 12 weeks to get help. And in the meantime, they're going to be in school, and we have to have safety plans and all those kinds of issues going on. It's just not fair to our teachers, it's not fair to the student in crisis, and it's not fair to everybody else who's trying to focus on education. So Governor, thank you again for being here.
Thank you.
And at this time, I'd like to introduce Dr. Chris Finello, and she's on the Governor's Behavioral Health Council. Thank you.
Thank you. Hi, good morning. I'm Christina Finello. I'm the Executive Director of the Pennsylvania Behavioral Health Council. I want to thank you for having us today. Loved hearing from the students. They make my job a lot easier. The Shapiro administration is making health and wellness of every Pennsylvanian a priority, and especially our students, and that does include mental health. We know that significant numbers of Pennsylvanians, including youth and adults with mental health conditions, have not fully received all the treatment that they need. We also know that suicide is a severe public health concern, especially among youth, where it's the 2nd leading cause of death. And we want people to be able to get the care that they need when they need it most. People should be able to access the right kind of treatment at the right time to meet their needs. So the work of the Behavioral Health Council will create a framework that's going to improve access, affordability, and quality of behavioral health services. Through this work, we will develop and recommend to the governor a statewide action plan to address gaps in access, affordability, and delivery of services, with the goal of removing silos across those state agencies, all those barriers from healthcare providers with payers, state and local government sectors, and hopefully decrease waiting times for people to get the services that they need. The Shapiro administration is making significant historic investments in mental health funding for schools, and has also increased community-based mental health funding in the counties. This administration wants to continue to make these important investments to create a resilient behavioral health system, improving the lives of those with mental health and/or substance use disorder needs. Our council aims to reduce the burden of mental health and substance use disorders on our communities across Pennsylvania, resulting in better overall well-being for our residents. Ultimately, our behavioral health system of care will help our youth, our families, our friends and neighbors here in Pennsylvania get the help that they need when they are in need. I'd now like to welcome to the podium the Director of Special Education here at Iroquois School District, Maria Mondalewski.
Thank you, Dr. Finello, and good afternoon. I am Maria Mondalewski, the Director of Special Education with Iroquois School District. I have the privileged opportunity to speak on the subject of school-based mental and behavioral health programming. Over the past several years, educators have witnessed a transformative shift in the landscape of education. As our society evolves, so do the needs of our students and young people. What was once perceived solely as structures for learning, populated by students and educators, has now evolved into havens that also accommodate mental health providers. School districts are observing increasing trends in student mental health challenges, leading to significant barriers in student success. According to the 2023 Pennsylvania Youth Survey, 14% of Pennsylvania students surveyed in grades 6, 8, 10, and 12 reported they engaged in self-harm behavior within the past 12 months. The reality of this statistic is observed within the walls of our school buildings. During the 2023-24 school year, Iroquois School District threat assessment teams completed 108 suicide risk threat assessments and 10 comprehensive school safety threat assessments for students ranging across grades kindergarten to grade 12. Each day, teachers, school counselors, school psychologists, paraprofessionals, and administrators find themselves on the front lines responding to students in mental health crises. As evidenced, we're routinely conducting safety threat assessments, facilitating behavioral health referrals, and continually assessing available resources for our most vulnerable students and families. However, the reality is sobering. Systems are exhausting available resources, and outpatient and intensive behavioral health services have long waiting lists and are often labeled at capacity, leaving schools grappling with the challenge of meeting students' needs without such limitations. Unlike other systems, schools lack the luxury of an at-capacity designation. Consequently, school districts are increasingly shouldering the dual responsibility of nurturing both academic excellence and addressing behavioral health concerns. It is evident that our schools have become the fiscal and programmatic agents of both academic and behavioral health systems, highlighting the very urgent need for comprehensive support and sustainable funding solutions. In addressing the crucial issue of public school funding, it is paramount to recognize the urgent requirements of school districts and our community as a whole. We cannot afford to resist change in a system that is ever-changing. It is for these reasons I respect and appreciate Governor Shapiro's advocacy and leadership on this very important and relevant issue. Governor Shapiro, thank you for being here today, and thank you for allowing Iroquois School District to be a part of these efforts.
Thank you.
It is now my honor to welcome Lexi Conti-Wendell to the podium.
Thank you, Ms. Mondalewski, and thank you for this opportunity. My name is Lexi Conti-Wendell, a soon-to-be 12th grader here at Iroquois. As someone who has navigated through her own mental health issues, this is a topic close to my heart and mind. I have seen family members, friends, and teachers battle depression and anxiety, so I know I'm not alone in this struggle. Their growing need for more mental health services is apparent. Talking with Governor Shapiro, it is clear that he is passionate about this topic. He wants to understand our needs as students and has ideas for how we can improve mental health wellness among young people of Pennsylvania. Making mental health services more accessible to students during the school day could be part of the solution. Right now, when we talk about mental health in schools, students automatically think of that one kid who tried to kill themselves, the student who was disruptive and pulled out of class, or the friend whose mom died. We don't think of it as an issue that everyone is facing, but mental health isn't just the extremes. It is more common than we think. At Iroquois High School, we face the same stressors that students across the Commonwealth do. Typical school pressures like grading, tests, and homework, but many of our students also have stressors of home life, whether they are struggling with money or where their next meal will come from. We worry about clothes, illness, domestic violence, or lack of support. Many students work to help their families pay bills or save up for college. That leads to another topic that weighs on all of us, the future. What will I be when I grow up? How will I afford to continue my training or education? And is that even an option for me? Add to these friendships, peer pressure, social media, athletics, dating, even school safety, and it's a wonder we're able to learn the curriculum that we're here in the first place. Even though we know that others are struggling, it is common to feel alone. Without a way to express our feelings, we are further isolated, and the cycle continues. Talking about our problems is only part of the solution. Having a safe space where we feel heard among people we trust, free of judgment, and with a trained staff who know how to lead discussions and provide thoughtful insight could be the way to go. Creating a space where mental health and wellness is a priority can be discussed openly and honestly sounds amazing to me. Too often when someone is struggling or in crisis, they are pulled away from our class or our school, and the rest of us are left to wonder, creating our own narrative or falling prey to the rumors. Being able to talk openly about mental wellness and getting support or offering support to others could make a huge impact on the well-being of our student body. During our assemblies on bullying, peer pressure, or self-esteem, we are sitting shoulder to shoulder with each other, nodding our heads at the experiences of one person who has struggled with their mental health. After we return to class, we are just as disconnected as we were before we went. We are talked at and not included in the conversation. These kinds of forums meant to raise awareness only emphasize the need for smaller group sessions that allow for deeper discussion and understanding. A more personal setting could develop empathy among the student body. As a community, we need to recognize that everyone is facing some kind of struggle and put in place avenues for them to get help. It's easy to point out our differences. Instead, we should focus on what makes us similar to one another, even if it is uncomfortable. Mental health is one of those common threads. We can manage our mental health together by connecting with one another. I thank Governor Shapiro for being here today and raising awareness on this topic, for dedicating time and funding to support the young people of Pennsylvania. I look forward to how we can develop stronger communities through mental health and wellness programs within our school. With that, I would like to welcome to the podium Governor Josh Shapiro.
Did an awesome job. Thank you. Thanks. Lexi, thank you so much. You are incredibly well-spoken, both at the podium and in the conversation that we just had with your fellow students. And I want you to know I learned a lot from you today. I learned a lot from your classmates or your schoolmates, including those that just graduated. And I want you to know that the conversation we had here today is going to impact not just this school district, I hope, and you heard from Superintendent Murray his sincere dedication to this, but also acknowledging he learned some things from the conversation today too. So your powerful voices are going to help not just here, but in the other 499 school districts across Pennsylvania. And I just sincerely want to say thank you. You got a great future ahead of you, and I'm excited to see you soar. So thank you. And I just want to thank everyone here at Iroquois for welcoming me here today. And I want you to know that this school district has a special place in my heart, not just because of the outstanding things I learned from the students here, but because my regional director, Mike Ferrito, right in the back, who's hiding there, he's a graduate of Iroquois, and I am told there is a yearbook around here with a picture of him as the prom king or something way back when. So we always have Iroquois on our mind, and Mike does a great job representing me here in northwestern Pennsylvania. I want to explain why I'm here today and why this conversation that we just had is so important. I care deeply about these issues of mental health and student well-being. And I want you to know why I care about them and how it is that I came to be so sensitive to these issues. First and foremost, Lori and I are blessed to have 4 children, 2 that are college age. Actually, our daughter just graduated from Pitt, and our son is a rising sophomore at Pitt, but 2 who are still in school, one entering 8th grade and one who will be entering 10th grade. And so we see on the faces and in the voices and in the hearts of our own kids the struggles that students are dealing with every day, which I think were exacerbated after the pandemic. But don't let anybody tell you that these issues didn't exist before the pandemic. For me, my real introduction to these challenges was when I served as Pennsylvania's Attorney General prior to being governor. And it was there that we launched something. I told the students about this. We launched an initiative called Safe to Say. It's an app that I know many students here at Iroquois use. And it's an app where when we designed it, the idea behind it was students would have an online anonymous platform where they could alert what would be us, although they didn't realize it, us at the time for me was law enforcement, alert us that, God forbid, someone was bringing a gun to school, or God forbid, someone was coming to school with the intention of harming someone else. Now, our 4 kids told me at the time, they said, Dad, that is the dumbest idea ever because no student is ever going to use this app. Well, I'll tell you what, years later, it's been my privilege and honor to tell my 4 children that they were wrong, right? Because we've received over 150,000 tips on this platform. Now, I want to tell you where I was wrong, and I'm willing to admit that I was wrong. The vast, vast, vast majority of the tips that came through had nothing to do with someone bringing a weapon to school to hurt others. And by the way, thank God. Instead, over 80% of those tips generated by students from school districts all across Pennsylvania, rural, urban, and suburban, had to do with mental health issues, had to do with students contemplating suicide or self-harm. We're the only state in the nation that stood up an infrastructure like this where we're getting real-time feedback from students about the struggles that they are facing. And I got to tell you, when this data came back, when I had the opportunity to talk more with students to understand what we were really seeing on this platform, what became clear to me was that we had a crisis in our classrooms all across Pennsylvania, and we needed to do more on this issue in our state government. Fast forward, the good people of Pennsylvania gave me the privilege and honor to serve as your 48th governor. And in my very first budget, I prioritized student mental health, something that heretofore really had not been a big focus. And actually, as you listen to the students, many of them commented that, it wasn't really something that was even spoken about. Now that's changed, certainly here at Iroquois, and it's changing in other classrooms and school districts across Pennsylvania. In my very first budget, I said we were going to create a brand new fund specifically dedicated to student mental health. I proposed, and we secured $100 million in new funding that school districts could only use for mental health. It meant, as you heard from the superintendent before, the ability to go out and hire mental health counselors, provide resources online, meet the needs of students where they were, and begin to address this crisis. $100 million is a lot of money, but it's only a start. This year, based on the success we had last year, we came back and I'm asking lawmakers on a bipartisan basis to again approve a fund for student mental health. That's part of my broader education budget, a budget that proposed an unprecedented increase in funding for our schools by over $1 billion, $1.1 billion to be exact. Importantly, for the first time, we would drive those dollars out under a new formula to districts that have been chronically underfunded and need it most. This district, as you heard from from your superintendent before, this district is scheduled to receive under my proposed budget a more than 12% increase in their overall funding that was just approved by the House a couple days ago and hopefully will be approved by the Senate very soon. But I want you to know I don't view these funding conversations just as numbers on a spreadsheet. I view this funding as critical to solving the problems that your superintendent, your principal, and others are leading on. Mental health is one of them. Here's another one. No kid should have to learn on an empty belly. People can't work with an empty belly. We shouldn't expect our students to be able to learn that way. That's why last year I was pleased we were able to secure universal free breakfast for school districts all across Pennsylvania. And I've come back to double down on that and make sure we have the funding for next academic year as well. We've got too many buildings that aren't cool the way this one is, during summer months and have infrastructure issues, where kids have to learn with asbestos wreaking havoc on their health. And we now have a more than $500 million statewide fund focused specifically on the infrastructure repairs we need in our schools, and I'm going to try and double down and do more on that. You heard from Maria before about the important work that she is doing in special ed. We have increased our funding for special ed to make sure that those students that need that funding can get it. And I'll tell you what, we learned from the students today the importance of making sure we are incorporating those students with special needs more into the kind of regular everyday activities of our schools. That was really important for me to hear. Again, the funding's important, but the way we drive those dollars out, the way we use them is really helpful. So that was another part of our conversation that was really useful. Under this proposed budget I put forth, it's going to help our school districts be able to get the dollars they need, particularly those that have been chronically underfunded. It's going to make sure students can learn on full bellies. It's really going to make sure we're addressing this mental health crisis and our infrastructure challenges and so much more. But I'll tell you what, I don't view budgets as just numbers on a spreadsheet. I view budgets as a statement of our principles and priorities. And for me, my principles, my priorities are making sure that every child of God gets a great opportunity, a real shot in Pennsylvania, and that starts in our classrooms. And so I really want to encourage all lawmakers, Democrat and Republican alike. I should note, where's our political science student who's going to college? She may have had to, there you are in the back. Here's a fun fact for you, okay, as you go forth in your political science studies. I am the only governor in the entire country with a divided legislature. Think about that. So for us to get anything done, we need Republican votes and Democratic votes. And you know what? For us to get anything done, it requires us to compromise. And compromise is a good thing. That's how you make progress in this nation. And so I'm going to work with Democrats and Republicans alike to find that common ground. But that common ground we're going to be working on is centered around making meaningful investments in our schools. And here's the last thing I'll say. This is a moment to make these meaningful investments in our schools. Consider this, in our state, we have a $14 billion budget surplus. That's a lot of money, $14 billion. And I've proposed a budget that invests heavily in education, public safety, and economic development. It does so in a really common sense way. And by the way, my budget also cuts taxes. It doesn't raise them. If the legislature were to adopt my budget as is, and I know they'll make changes and we'll compromise, but just for argument's sake, if they were to adopt my budget as is, we would be able to address these many challenges and we'd still have an $11 billion surplus at the end of the day. I share that with you because now is a moment where we need to invest. Now is a moment where your representatives and your senator need to come together and invest in school districts like Iroquois, and invest in these students and address these serious challenges that we face. And so the final thing I want to say is where I began. Lexi, to you and to your fellow students, thank you for helping us not just pass a budget, but make sure that these dollars solve the challenges that we are facing, address the needs of students. And thank you to this school district and Superintendent Murray for having the courage to have these open conversations about mental health, for inviting me here today to learn, and ultimately, through this learning I do, to better the situation for students all across Pennsylvania. So thank you all very, very much. We appreciate that. And with that, Lexi has agreed to answer all the questions from the media. So thank you. We'll answer a few questions of the media, and then we'll get a chance to visit some more.
Mr. Governor, you'd mentioned that the House has passed an education bill that is largely in lockstep with your budget proposal.
It is my budget proposal.
We know that, however, the Senate Republicans have already said there's virtually no chance of that getting through as is. In what areas do you look as the leader of the Democratic Party on a state level to make concessions, to negotiate and get this thing done?
Well, I'm the governor for all Pennsylvanians, and my job is to find common ground between the House Democrats who lead the House and the Senate Republicans who lead the Senate. And it seems to me it's pretty darn common sense to invest in student mental health. It's common sense to invest to make sure students can learn on full bellies and school districts have what they need. Listen, this is a school district that is going to receive a more than 12% increase in their overall funding. I don't know why their senator wouldn't be for that. We can invest in our schools. we can invest in economic development, public safety, other important things. We can cut taxes and we can still have a surplus at the end of the day. We'll find common ground as we did last time, but to me, this education investment is common sense and it's needed.
Are you confident that this will get done sooner than last year's budget? Do you think you're in a place where we can get to that finish line by the end of the month, or at least close?
Well, remember, we got our budget done in early July last year. I think June 30th, July 1st is when it should be done. There were some games that went on after that that prolonged it, but school districts got their money on time. Everybody got what they needed. And understand, we ended up investing more in public education last year than at any other time in our Commonwealth's history. We made progress. And yeah, I know sometimes it looks a little noisy between Democrats and Republicans, and I realize sometimes folks feel the need to chirp at me as the governor. No problem. As long as students win at the end of the day, I'm happy to accept their chirping all the time. Now, behind the scenes, we've had some really constructive dialogue, Democrats and Republicans alike. I think we're all in a good position now to understand the needs that exist in education, safety, economic development. I think we all want to make investments. We've got some different ideas on how to do that. That's okay. I'm willing to compromise. And while I don't know exactly how the numbers will shake out in this budget, here's what I absolutely can tell you will happen. We will all compromise, and no one will get everything they want. I won't. The Republicans that lead the Senate won't. The Democrats that lead the House won't. But at the end of the day, when we compromise, everyone will be better off. And that's the way the system is supposed to work. And I'm confident we'll be able to get that done relatively soon here.
Governor, with the decline of the PASHE University system, fewer young people interested in getting into the teaching programs there, how do you make Pennsylvania more attractive to potential teachers coming to our state?
We are 49th in the nation when it comes to investing in higher education. And Lexi, you want to be first, not 50th. So 49th is not where you want to be. That is why I proposed some sweeping reforms and investments in higher education. And I've been all over the Commonwealth talking about it, in our PASHE schools, in our community colleges, and in our state-related universities like Penn State or Pitt. It is critically important that we both reform and invest in higher ed. After a few months of lawmakers kind of trying to pick apart my plan, I said, okay, well, what's your plan? Now, historically in the legislature, this goes back to Ethan's question a little bit about compromise. Historically in the legislature, they might sort of chirp at you and disagree with your idea and then never put their idea forth. Well, you know what happened as a result of me challenging lawmakers and asking people to raise their hand and say, are you okay with being 49th in the nation? The Senate Republicans passed their plan yesterday on higher education. Let me tell you, there's some good stuff in there. Some stuff I maybe don't agree with, but there's some good stuff in there, and it provides us a foundation to find some common ground to get something done. And when we get something done, to the specifics of your question, our PASHE schools are going to be better off. Our community colleges, like right here in Erie County, I was privileged to deliver the commencement address last year at your community college. They're going to be better off. We're going to be strengthening our state-related universities. There's something really, I think, good happening where people, Democrats and Republicans alike, are coming together around the idea that we've got to do something more on higher ed to save our system. And I'm hopeful over these next several weeks that we'll be able to find some common ground in the proposals that have been put forth.
I was hoping to ask you about cyber school tuition caps,
Sure.
one of the ways that you're going to be getting the funding for this. So I spoke to some parents who said, for my child's mental health, I need cyber school.
Yeah.
And there's a lot of talk about being accepting of change and realizing sometimes what the status quo didn't work, but now there's going to be cuts to that program. How does that jive with providing what kids need as far as mental health when maybe brick
Sure.
and mortar is not what they need?
Yeah, and if I may just respectfully push back on the way you framed your question, I don't mean this to be argumentative in any way. I'm not proposing any sort of cut. Cyber charter schools can continue to operate, and parents who feel that that's the best option for their students, for their children, they can put their child in a cyber charter school. Here's what needs to be reformed, and there is, I think, bipartisan agreement around this. If a student in this school district chooses to go to, we'll call it Cyber School A, and a student in the school district that I reside in, whether in Dauphin County where the governor's residence is or Montgomery County where our family home is, chooses to go to Cyber School A as well, Cyber School A gets an entirely different rate of reimbursement for that student attending, even though they're offering the exact same program to a student coming from Erie or from Montgomery County. So reform number one is making sure that we create uniformity, because we can all agree, it's common sense, that whatever the program costs, it's not different for the student from Erie versus Montgomery County. They're getting the exact same service. That's number one. The second reform that I think there's a lot of general agreement on is that to operate a cyber charter school, so that's a school without the bricks and mortar of, say, an Iroquois here. I know you're not a charter school, but you're a bricks and mortar school. It just doesn't cost as much money. It doesn't cost as much money to operate a cyber charter as it does to operate a bricks and mortar school. That is a point of fact. And so the areas where we are looking to make reforms are to create uniformity in whatever that rate of reimbursement is to the cyber charter school, and frankly, to make sure that they're not drawing down as much money out of our public schools when they don't have a bricks and mortar operation. But don't let anybody tell you that we're trying to shut down a cyber charter school or shut down an avenue that a parent believes is best for their child. If that's where a parent wants to send their child, they'll still be able to do that in Pennsylvania. But we shouldn't be wasting taxpayer dollars, and we shouldn't be robbing our school districts, our public school districts in Pennsylvania, of the precious resources that they need.
Thank you all.
Thanks, everybody. Lexi, you did a great job.
Thank you.
Yeah.
It's very nice meeting you.
Thank
Thank
you.
you for all the work that you do for us
You
here
too.
at State.
I appreciate it.